Dear friends, today we are going to discuss about the immunosuppressive drugs. The immunosuppressive drugs which are used in the kidney transplant patients. Basically, we are going to discuss only the name and the dose of the drugs here. We are not going to discuss about the mechanism of action of the drugs, and we are not going to discuss about the side effect of the drugs. To discuss about the mechanism of the action and the side effect of the drugs, we will make a new video and we'll discuss later on. So first of all, if we discuss about the immunosuppressive drugs which are used in kidney transplants, are number one is the glucocorticoids. So if we talk about the glucocorticoids, as we know very well about the glucocorticoids, so we are not going to discuss about the glucocorticoids here. Second category comes the basically immunophilin binding drugs. If we talk about the immunophilin binding drugs, there are two groups in this category. One is the calcineurin inhibitor and number two is the mTOR inhibitor. If we talk about the calcineurin inhibitor are basically two. Number one, the most common is the cyclosporine and tacrolimus. If we talk about the cyclosporine, the dose of the cyclosporine is the 9 mg per kilogram body weight. And if we talk about the tacrolimus, the dose of the tacrolimus is the 0.05 to 0.075 mg per kilogram body weight. So we are discussing the immunophilin binding drugs, and immunophilin binding drugs are basically two types. Number one is the calcineurin inhibitor, and calcineurin inhibitors are commonly the tacrolimus and cyclosporine. Now the second category is the mTOR inhibitor. If we talk about the mTOR inhibitor, basically two common drugs are used in this category. Number one is the sirolimus and second is the everolimus. If we talk about the sirolimus, the dose of the sirolimus is the 3 mg per meter square initially, and then 1 mg meter square later on. If we talk about the everolimus, the dose of the everolimus is the 0.75 mg twice a day. So these are the mTOR inhibitors. So we are discussing the immunosuppressive drugs which are used in the kidney transplants. The first category is the glucocorticoid. Second category is the immunophilin binding drug. If we talk about the immunophilin binding drugs, there are two types of drugs. Number one is the calcineurin inhibitor and number two is the mTOR inhibitor. If we talk about the calcineurin inhibitor, there are two drugs, there are tacrolimus and cyclosporine. And if we talk about the mTOR inhibitor, there are two drugs, the sirolimus and everolimus. Now the second category comes the purine inhibitors. If we talk about the purine inhibitors, there are two drugs. Number one is the mycophenolate mofetil and the second is the mycophenolic acid. The dose of the mycophenolate mofetil is the 1 gram twice a day, and the dose of mycophenolic acid is the 720 milligram twice a day. So these are the purine inhibitors. If we talk about the next drug, the next is the pyrimidine inhibitor, and the drug is the leflunomide. If we talk about the leflunomide, the dose of the leflunomide is the 100 milligram is the loading dose, and further 20 to 40 milligram once a day basically leflunomide is used. Next is the antimetabolite. If we talk about the antimetabolite, the drug is the azathioprine, and the dose of the azathioprine is the 3 milligram per kilogram. The dose is the 3 milligram per kilogram body weight initially, and then after that 1 milligram per kilogram once a day is used, basically the azathioprine. So this is the antimetabolite. So we are discussing the immunosuppressive drugs. So till now we have discussed number one the glucocorticoids, number two the immunophilin binding drugs, number three the purine inhibitors, number four is the pyrimidine inhibitor, and then antimetabolite. Now we come to the polyclonal antibodies. The example of the polyclonal antibody is the thymoglobulin. Actually, thymoglobulin is the induction agent, and this is a very important induction agent, and this is very much commonly used in at the centers where the transplants are being done. So the thymoglobulin, the dose of the thymoglobulin is 75 milligram once a day, or we can say the 1.5 milligram per kilogram body weight. Basically this is given before the surgery, and this is given up to the 4 days, or depends on center to center. So this is the thymoglobulin, and this thymoglobulin is used as an induction agent. So this is the polyclonal antibody. The next is the monoclonal antibody, and the example of the monoclonal antibody is the miromanab, and the dose is the 5 milligram IV once a day for 7 to 40 days. So this is the miromanab. The next category is the non-depleting antibodies. Non-depleting antibodies, the main drug and the important drug in this category is the basiliximab. Basiliximab is also an induction agent, and basiliximab is given 2 hours before the surgery, and this is given 20 milligram IV either bolus or infusion, and this is being repeated after 4 days of the surgery. So this is the basiliximab. Basiliximab is the induction agent, and this is the non-depleting antibody. Now the next drug is the fusion drug, and if we talk about the fusion drug, the drug is the belatacept, and the dose of the belatacept is the 10 milligram per kilogram body weight and this is basically given day 1 and day 4. This is belatacept is given on day 1 and day 4, and then this is being repeated at the end of the week of 2nd, 4th, 8th and 12th weeks. So this is about the immunosuppressive drugs. The immunosuppressive drugs which are used as a immunosuppression, either induction or maintenance therapy in the kidney transplant patient or in the renal transplant patients.